Welcome to the Deep Dive. Today we're launching into a pretty fascinating deep dive. We're looking at a systematic review from April 2025 on medical imaging breakthroughs and also an expert analysis of new radiology trends.
Right.
Our mission really is to give you a shortcut, get you right up to speed on how this tech is fundamentally changing how we see inside the body and, diagnose diseases. So, okay, jump right in. There's this huge wave of innovation. What's the most striking thing you're seeing? It feels like it's more than just taking pictures now.
Absolutely. What's truly fascinating, I think, is how several big tech trends are converging. They're really reshaping the whole field. First off, let's talk photon counting detectors.
Okay.
This is revolutionizing X-ray stuff like CT scans. The new quantum CT system, for instance, is a key example here.
Right, quantum CT. You mentioned isotropic 0.1 millimeter resolution at submillisievert dose levels. That sounds incredibly precise.
Yeah.
For us non-specialists, what does that actually mean for a patient diagnosis?
Think of it like this. You're upgrading from maybe a slightly fuzzy old photo to a super sharp 3D map of the inside of your body. Really detailed.
Wow.
And it gets that detail with, get this, up to a 95% reduction in radiation compared to standard CT.
95%, that's huge.
It's monumental. It addresses that long-standing worry about radiation dose, makes it safer, potentially allowing more frequent scans if needed. And what really boosts the power of these new imaging tools, beyond just the clearer pictures, is how we interpret all that data. And that's where AI comes in, artificial intelligence.
Ah, yes. AI, it seems to be everywhere.
It really is enhancing almost every single step. Acquisition, interpretation, the whole chain.
Yeah.
And here's where it gets particularly interesting, I think. There's a deep learning system for fMRI.
fMRI, functional MRI, right, looking at brain activity.
Exactly. It's called decode speech. And it has shown 85% accuracy in basically reconstructing the words someone hears just from their brain activity.
Wait, reconstructing speech from brain scans.
Yeah. Imagine what that could mean for patients who are locked in, unable to communicate otherwise. It's a potential pathway.
Wow, the implications there. That's incredible. Truly life-changing potential. Are there broader uses for AI in imaging you're seeing beyond that specific example?
Oh, definitely. Beyond just decoding speech, AI is transforming how radiologists, quantify things. It's not just, is there a tumor, but AI can measure its exact size, its density, maybe even predict how it might grow, super accurately.
So turning observations into hard data.
Precisely. It makes assessments much more objective, measurable, enhancing everything from ultrasound to generating better MRI images, too.
It's amazing what we can see and understand now. But these breakthroughs, they need to actually reach people, right? Not just be stuck in big research hospitals. Are things getting more accessible?
You've hit on a really crucial point there. And that's where miniaturization and portability are making a difference. Advanced imaging is moving out of just specialized centers.
Like bedside tech.
Exactly. We're seeing things like wearable FNRS systems, that's functional near-infrared spectroscopy. It monitors brain activity non-invasively, something like the Neuromonitor system.
Yeah.
These wearable devices can potentially predict secondary brain injury maybe 6 to 8 hours earlier than the usual methods. That's point-of-care diagnostics, bringing sophisticated tools right to the patient.
So much earlier detection, intervention right there, huge clinical impact. And does this push for more detail also apply to like the cellular level? What's happening inside our cells?
It does. It extends really nicely into molecular and functional imaging. The focus isn't just anatomy anymore. It's about visualizing actual physiological processes, molecular targets.
Right.
There's a new PET tracer, for instance, called neurosynapsy. It images synaptic density, the connections between brain cells, and it seems it can detect neurodegenerative changes maybe 5 to 7 years before symptoms even start.
So PET tracers, for anyone listening, they're like tiny, safe beacons highlighting specific biological activity. And this neurosynapsy lights up brain connections, spotting changes for things like Alzheimer's years early. That's a massive shift towards proactive care.
Absolutely. It helps move healthcare away from just reacting to symptoms towards predicting and preventing.
Yeah.
And across all these innovations, we're seeing huge performance gains overall, like up to 75% faster scan times.
75% faster.
Yeah, up to 40% better resolution in some cases, and maybe up to 40% improvement in diagnostic accuracy, too. These are significant numbers.
So let's bring it back to the listener. What does all this tech mean for you, whether you're a patient, a clinician, or just interested in where health is going?
Well, that's the big question, isn't it? On one hand, these advances clearly mean earlier detection, less invasive procedures, much more precise diagnoses, fantastic potential.
But there's always a but.
There is. They also bring big challenges. Think about equitable access. How do we make sure these amazing but often complex and expensive technologies get to everyone everywhere, not just in wealthy areas or specialized centers?
Yeah, that global access question is critical.
It really is. That's a major focus for future research, for implementation strategies. How do we roll this out fairly?
This deep dive, it really underscores how medical imaging isn't just seeing inside anymore. It's becoming about predicting, personalizing. It's fundamentally changing healthcare.
It truly is. The very nature of diagnostic knowledge itself is transforming. You know, what really stands out to you about how all this will redefine that relationship between just seeing something, analyzing it, and actual clinical expertise going forward? It's a pretty fundamental shift to think about.